In this video, a nurse will understand the various aspects of the bandaging technique, steps of procedure, article required, aftercare, and most importantly, what to do when things go wrong. In other words, the common clinical errors. It is a strip of material which is used to immobilize and support the injured part of the body. Bandaging is a process in order to protect or cover the wound. So next we are going to discuss about the purposes of the bandaging. There are various purposes of bandaging such as to protect the wound from contamination, to apply the pressure, to protect the wound from the hemorrhage and to protect the wound from the infection. So next we are going to discuss about the various types of bandaging. The types of bandaging are as follows, that is circular bandage, spiral, reverse spiral, spica, figure of 8, jaw, capling, abdominal binder. Spica bandaging. Spica bandaging is a form of figure of 8 bandaging. In this type of bandaging, the one turn is very much longer than the other turn. And this type of bandaging we are widely using in case of the shoulder, groin and thumb. So next, we are going to show you the demonstration of the spica bandaging. Equipments required: a tray containing loose gloves, appropriate bandages, scissor, adhesive tape, dressing material like gauze, kidney tray. Spica bandaging. Introduce yourself to patient.
Good morning, sir. This is Shilpa, your science staff from 8 am to 2 pm. Sir, may I know your name?
Karthik. Check doctor's order sheet. Explain the procedure to patient.
Okay, so Mr. Karthik, as per your doctor's order, I have to apply a bandage.
Perform hand rub. Wear loose gloves. Select the bandage of proper size and material. Put the patient in a comfortable position and provide privacy if required. Support the injured area while bandaging. Face the patient while applying the bandage except when applying onto the head. Always apply bandage from inner to outer and far to near end. Make 2 circular turns to anchor the bandage. Place a small pad of cotton wool in the affected axilla. Take bandage and fix it with spiral turns around the upper part of the wrist. Bring it across the thumb and wrist again, covering 2/3 of the previous turn. Repeat the turns until the whole thumb is covered. and secure the bandage. Aftercare. Discard the waste according to biomedical waste management policy. Perform hand hygiene. And document the procedure in nurse's notes. Key points to remember. Always check for the correct size and type of bandaging according to the location of wound. Bandaging should not be too tight so it can interfere with the blood circulation.